This is the pelvis. This red area right here, these are the pelvic floor muscles. When we get pain in this area for a long period of time, we call it chronic pelvic pain. There's a whole population of men out there who struggle with life-altering pelvic floor-related problems. And if you're watching this video, chances are you're looking for a solution. So in this video, I want to offer you 2 techniques that can help you gain control of your condition and get you back to living your regular everyday life. Chronic pelvic pain can be defined as pain in the pelvis that lasts for greater than 6 months, and it's severe enough to be functionally limiting. There are all sorts of medical diagnoses that are associated with chronic pelvic pain, and it's impossible to go over it all in one video. Perhaps you've had an injury to your prostate gland, such as prostatitis, or perhaps there's been a condition to your lower urinary tract. Or maybe there's just been some kind of neuromuscular injury or trauma to the region directly itself. In chronic pelvic pain, the pudendal nerve is often an area of focus, and injury to this region is often diagnosed as pudendal neuralgia. The pudendal nerve exits out of the spinal nerve roots of S2, 3, and 4, and it travels through several muscular and ligamentous structures until ultimately it branches out to 3 nerve roots that provide motor and sensory supply to the pelvic floor muscles. And it's not just the pelvic floor that this nerve innervates, but we're also looking at the perineal regions, we're looking at the external urethral sphincter, the urogenital diaphragm, anal rectal canal, and also the penis. As you can imagine, injury to this nerve can cause a whole host of problems. Changes to the pudendal nerve can and will increase the tone of the pelvic floor muscles, and with greater tone comes a decrease in blood flow, leading to these taut, painful bands of muscle known as trigger points. Over time and left untreated, this can not only lead to pain at rest, but pain with regular everyday activities such as urination, defecation, sexual activity, and in some cases it can even cause erectile dysfunction. If you're a man with chronic pelvic pain, I would highly recommend that you go seek a physiotherapist who specializes in men's health, as there are certain assessment and treatment techniques that can be done to actually hone in on exactly what you have and develop a treatment plan as to what would be most suitable for you. That being said, if you don't have access to a physiotherapist, don't stress. There are some things that we can do to try to help with your pelvic floor pain. First, we have to understand what we are trying to accomplish. We want to find ways to relax the pelvic floor. Performing strenuous Kegel exercises will not be the way to go, as you're simply creating more pressure and stress in an area that's already in overdrive. Performing high-intensity strength training can reinforce the motor pathways of over-recruiting the muscles and should be limited if this is a trigger. Instead, we want to work on mindful relaxation and work our way towards specific lengthening exercises. So what you want to do is find a quiet environment where you won't be disturbed. You will need 2 soft balls you can inflate to the desired firmness. Find the ischial tuberosities of the pelvis, or the sit bones, and gently place the 2 balls in this area. If this isn't comfortable, you will need to deflate the balls further. Visualize a slight descent of pelvic floor onto the release balls. You want to feel a softening or a letting go of tension in the pelvis. You want to draw awareness to the sensation along the muscles of the pelvic floor and incorporate gentle side bending, flexion, extension, and rotation. It is critical to be present in the moment and to not fixate on an end result or an outcome. Spend 3 to 5 minutes staying present with the feeling of gentle, non-noxious sensory stimulus on the pelvic floor. If you feel an area of pain during movement, you want to accept it and allow your body to relax naturally. So the technique itself is intended to use imagery and mental focus to draw awareness to what you're feeling in the moment. It's not meant to be a myofascial release technique by any means, but more so accepting and feeling the tension within your body, and only then will your body really feel like it's able to relax. From what we understand about our pain science research, we know that if we've been in a state of chronic pelvic pain for a long period of time, such as 6 months, there are changes that take place in our nervous system that cause that hypersensitivity and overactivity in the pelvic floor or the affected region without having anything to do with the actual health of the pelvic floor muscle, tissues, skin, or the viscera. So when pain becomes really chronic, it's really important to reconceptualize the pain using mindful practices and modulation of these brain pathways that take place. The second technique is a reverse Kegel exercise. First, you want to think about allowing the pelvic floor to gently descend downwards during a deep breath while sitting. Practice this technique with proper visualization for 3 to 5 breaths. Sometimes it can be easier to feel this in supine, with your hand on your abdomen to feel the belly rise into your hand. As you breathe, you want to feel your pelvic floor move in the direction towards your feet. You can progress this by flexing your hips, resting your feet on the wall. As you get the hang of this, you can progress to 4-point and quadruped positions. In the 4-point position, you can move your hips backwards, gently relaxing and lengthening the pelvic floor in the direction away from you. Then, you can externally rotate your hips to include a gentle stretch of the adductor muscles and obturator internus while focusing on the lengthening of the pelvic floor. Next, gently rotate your pelvis into an anterior and posterior direction, allowing a stretch of the lumbar fascia. Perform each quadruped exercise 10 times for 3 sets, allowing 30 seconds of rest in between sets. This entire reverse Kegel routine can be done 2 to 3 times a day, dedicating at least 10 minutes of focused attention to the practice. So to properly assess chronic pelvic pain, we have to work on 2 pain systems within our bodies. One, the nociceptive biomechanical pain, which is another word for pain caused by the actual tissue injury or pain associated with movement. Number 2, we have to work on the nociplastic pain, which is this learned pain that's created within our bodies as the pain continues to manifest for a long period of time. On a side note, this is a fantastic book for those who want to know more about chronic pelvic pain and listening to other men talk about their success stories and potential protocols for treatment for their conditions. So I wanted to make this video because I found there's so many men out there who suffer with chronic pelvic pain, and there's not a whole lot of information on YouTube regarding, okay, what is this condition? What do I do about it? Who can I go to see? And so, I want the men out there who feel alone in this that there are solutions and that you can go and get help. So if you want me to cover more videos regarding conditions like urinary incontinence or erectile dysfunction, let me know in the comments. Like and subscribe, please, and stay tuned for more content regarding men's pelvic floor because, yeah, it's a very underserviced population on YouTube.